Being a recipient of the Williams Award is a spectacular honor. I recognize that this award is acknowledgement from my peers and from my prior institution, the University of Illinois at Chicago, UIC. This is primarily for work that I have done in concert with others. In my view, it is the entire team at UIC that should receive this award. Medicine is truly a team sport. As a leader and a physician scientist, I am resolved to find solutions to healthcare problems. These solutions include incorporating technological advances, including artificial intelligence, fostering community engagement, and unwavering commitment to health equity. I am the daughter of Irish immigrants. No, that is not my castle. And I am part of the first generation of my family to go to college, as well as the first physician in my family. As an award recipient, I cherish the opportunity to emphasize medicine at its most laudable core, and that is care for everyone that walks in our doors. I was previously the chair of medicine at UIC. I value the integration of all of our missions, education, research, clinical care, and commitment to our local and global community, all within the context of health equity. My goal is to incorporate inclusion into every aspect of our day-to-day care of our patients, while we teach our students and we foster scientific innovation. We focused on paying attention to inclusion and diversity and recruited a marked increase in underrepresented minority house staff from 6% to 35%. Also, we lobbied to ensure that the UIC Department of Medicine was the first site to participate in the NIH Bias Reduction in Internal Medicine, the BRIM study led by Dr. Molly Kearns. There are now multiple sites all across the country which focus on breaking the bias habit. Recognizing the importance of these initiatives for UIC and for greater academic institutions is part of the downstream effect of the Williams Award. In terms of academic internal medicine, my time as president of APM in 2020 to 2021 was a time of tremendous challenge and change across the world. During that time, we led multiple interactive town halls. I led chairs to publish a perspective proudly entitled Voices for Social Justice and Against Racism. I was also honored to interview Dr. Anthony Fauci for a key session for the AIM conference. At that time, Dr. Fauci was doing 20 interviews per day related to the pandemic. I will never forget how he lit up when I asked him about his time as a chief resident. Academic medicine and his training as both a student and a mentor had prepared him for leadership during the pandemic and beyond. I would be remiss if I did not speak with joy at being a part of APM. Health equity and social justice are recurring themes germane to my DNA that have been fostered, encouraged, and embellished during my time at APM. I consider this award an acknowledgement of how critical these themes are to our academic mission. I would like to thank all my colleagues and staff at APM. I would also like to thank my chosen family, the friends, staff, faculty, and trainees at UIC. I am so honored by their nomination, particularly Drs. Kondos, Jacobson, and Dudek. And I want to also thank the two one and onlys, Lisa Steiger and Catherine Dominguez. I want to thank my other chosen family, friends, staff, faculty, and trainees at the University of New Mexico. For my family, I thank especially my brother Peter, who has never stopped believing in me. And I thank my daughter, Devanora, who works at the WHO and is busy changing the world. And I thank my beloved husband, Dr. David Perkins, who is partner in all that I do. Thank you all so very much.